Right, I'm going to spend the next 15 minutes or so looking at how public opinion has changed, and that's both because of the pandemic and during the course of it. Just in one short month, we've seen shifts of opinion of a scale that we might not have expected before. And I'm going to look at how public opinion has changed in 5 main areas. So, first of all, of course, we've seen concern levels grow over the course of the pandemic. But what our data also shows is how levels have changed, when they changed, and what it is that we're concerned about. So our latest data shows that as we are concerned about the risk of coronavirus to the country, there are high levels of concern about that. Over 9 in 10 people say that. But you can see back in mid-March, there are already quite high levels of concern. And this is something we've seen in our global tracking as well. So in our global tracking, we've got the UK amongst 14 countries. And for some time, actually, we saw that the UK public really saw this as a problem for other people. We were concerned, we saw it as a threat for the world, followed by the country. But there were much lower levels of concern about how it would impact on individuals and ourselves. And this is still true to some extent. So you can see here, around 3/4 of us say that we're concerned about the risk to ourselves posed by coronavirus. But what you can also see is this rapid increase in concern around the end of March. So you can just see in 1 week how much that increased. And that's when it really became real for people. It started to become something that wasn't just about other people out there. Suddenly it was something that could affect each and every one of us. And obviously that coincided with the lockdown. And what we're also seeing is this is as much about a financial impact as it is about a health impact. So people are worried about being able to pay their bills. They're saying that they either have or they're considering borrowing money, using their savings, using credit cards, overdraft, that sort of thing, possibly because of a lack of work in the short term, but also because of the threat of redundancies. We've also seen that globally there is concern about the potential for a global recession. And I think to some extent, that's driven by the uncertainty of how long this might last. In the UK in particular, we were quite quick to recognise that we were in this for the long haul. So back when we were seeing majorities in other countries, and that was countries who were ahead of us or behind us on the curve, thinking that things would be back to normal by June, we had about half of people in the UK saying that, so quite a bit lower than in some countries. And we've seen that decrease rapidly from week to week. So now a minority think things will be back to normal by June. And actually, 1 in 5 of us think that this is going to last into next year. And we're worried about how long the economy is going to take to recover. So around 1/4 are saying that the economy will recover quickly once the lockdown is over. So we're quite pessimistic about this, especially compared to other countries. And of course, none of us have ever lived through anything like this before. So we're having to change our behaviours. Where possible, we've moved much of our lives online, whether that's banking or shopping or entertainment. I think the shopping figure would probably be higher. It's only limited by our ability to get delivery slots at the moment. But we are moving much of our lives online and changing much of our day-to-day lives. But we're finding those lifestyle changes hard. We're finding it harder to do our normal things than we did before the pandemic. So finding it hard to stay positive about the future, positive day to day, and finding it harder to keep in touch with our loved ones. We're also finding practical things more difficult. So getting things we need from the shops. Obviously that was higher earlier on in the pandemic, in the outbreak, when we were seeing those stockpiling behaviours. But there's still around 3/4 of people were saying they're finding it harder to get what they need from the shops. Also finding it harder to work. That might be through sickness or because of business not being open, working from home arrangements. Of course, lots of people are having to look after children, having to be childminder and teacher as well as do their day job. They're finding lots of these things more difficult than they did before the outbreak. But we are trying to make the most of it, whether that's through having fun with children, using the time that you've got with them to have more fun with them, or picking up a lapsed hobby or taking up a new hobby, for example. So trying to use those lockdown hours productively. Third area where we've seen a shift in public opinion is in our support for the government, and we've seen that grow over the course of the pandemic. In particular, we've seen our favourability towards Boris Johnson grow, so over a half say that they've got a favourable opinion of him now. This is something we see around the globe in other countries as well, not everywhere, but it's a general trend in times of crisis, sort of rally around the flag effect. And I think for Boris Johnson in particular, there might be a little bit of sympathy mixed in with that as well because of being in hospital. But this growth in support for the government, it's actually despite the fact that a majority of people think that the measures taken were taken too late. So around 6 in 10 people say the government action was taken too late. But of course, when you're looking at anything, when you're asking people about government, political leaning comes into it. So you can see here among Labour voters, around 3/4 of people think the measures were taken too late. One thing that's remained constant throughout the pandemic has been our support for the NHS. Our data has long shown the British public's relationship with the NHS. We love it, we're proud of it, we want to protect it. And in these times, it's become a focal point. And of course, there was a lot of talk at the beginning in particular about the strain on the NHS and would it be able to cope. But actually, as the NHS has adapted, it's changed the services it provides, it changed the way it provides services, it's increased capacity, new hospitals have been built. And as all of that's happened, our confidence in its ability to cope with the impact of coronavirus has grown. So around 8 in 10 people now say they're confident. We also see this in comparison with other countries as well. In our global studies, we see 9 in 10 people in the UK saying they think the NHS is doing a good job at the moment, and that's much higher than we see in other countries. And as I said, none of us have ever lived through something quite like this before. And as a result, we've started to accept things we wouldn't normally accept. For example, we're willing to give up our privacy to fight the spread. We've got 2 in 3 people who say they would support the government using mobile phone data to track people who've been diagnosed with coronavirus and those that have been in contact with them so that they can be alerted. The one that stands out for me, though, in this question is the bar at the bottom. So you've got half of people saying that they'd support the government using mobile phone data to find out if individuals are breaking the rules and penalise them for that. And face masks. This is something that has been in the news quite a lot. It's been talked about quite a lot in the last week or two. And we are seeing that more of us are starting to wear face masks. You can see that the numbers have increased week on week. We are still a long way behind many other countries, though. And of course, some of those countries, their government advice is different, and they have different cultural norms around wearing face masks as well in some cases. And we do have different attitudes to them. So you can see in the UK column, we've got our blue dots, which are slightly higher than the lighter blue ones. So we're more likely to say we don't see the value in face masks if we're not sick, possibly because of the advice that we've read or heard. And we've heard that they're not available or we wouldn't be able to get hold of them, they'd be too expensive. You can see other countries, they've got their lighter blue dots higher up, so they're saying they're more likely to say that people should wear face masks even when the pandemic is over in order to protect each other. And they individually expect people to wear face masks around them so they don't get sick. So real different attitudes from country to country about face masks. But when you explore it further in this country, we see that actually people are willing to wear them. So we've got 3/4 of people say that they would be likely to wear a face mask in public if government advice said to do that. And we've also seen support for other measures increase over the course of the pandemic. So we saw back in the middle of March, around half of people in the UK said that we should close borders until the virus was contained. And you can see at that point, we were a little bit lower than many other countries in the survey. And in the course of just 1 week, again, we saw a huge increase in support for closing the borders in this country. So just before lockdown, I think that, again, it was when it was starting to become real and become a little bit closer to home. You don't normally see this sort of shift in just 1 week, of course, in a survey. And so on the one hand, we've been forced apart by the virus and possibly becoming a little bit harder edged. But on the other hand, we've seen that people are becoming more caring for each other and their communities. When you ask people how they're feeling, the overriding emotion that we've seen in our data is concern for the vulnerable. So 2/3 of people in the UK say that they're concerned for those who are vulnerable or weak. And this is higher than we're seeing in other countries in the survey. And that's the same week on week. They're also saying that they're worried about their family and friends. So they're taking action to check in on them, check that they're okay, check with neighbours that they've got everything that they need. And there's a sense that it will bring us closer together. So half of people in the UK say that I will become closer to family and friends as a result of the pandemic. And finally, it's given us more of a focus on our emotional being and our mental health and mental well-being. Now, mental health is something that we've seen rise in salience in our surveys over the last couple of years. So when we ask about where should funding go in the NHS, we've seen mental health services rise up the agenda. And I think the pandemic has really brought this into focus for a lot of people. So you've got 1 in 5 people saying that they're concerned about mental illnesses, such as anxiety and depression. And that's higher amongst women than it is amongst men. And we're also seeing women are more likely to say that they're taking action to cope with the impact of the coronavirus on their mental well-being. So in little over 1 month, we've seen a scale of change we could never have anticipated. We've seen our engagement with the virus, our concern about it, really ramp up as it's progressed and it's become something that's much closer to home. Overnight, we completely changed our day-to-day lives. We changed the way we work, the way we shop, the way we interact with others. We've rallied around those in charge to some extent, and we've certainly valued the efforts of a really wide group of people. I mentioned the NHS earlier, but I think over the course of the pandemic, we've also seen the public celebrating a wider group of workers, for example, those working in social care, the delivery drivers, the shop workers, other people like that that perhaps weren't celebrated before, I think are being celebrated more now. And while we haven't exactly embraced a new normal, we've come to accept it. And we've become more caring as well. We're seeing a more caring side. We care for each other and our communities more. So what does all of this mean when we do emerge from lockdown? What does it mean? Which of these changes will endure? I think there are some questions about which ones we'll see endure, but also in the short term, what does that mean for the way that we work with the public, whether that's government, policymakers, service providers, brands? What does all of this mean for the way in which we interact with the public? I think it's safe to say I've only scratched the surface of the data that we've got on this subject at the moment. So there is more available if you are interested in delving a little bit deeper into anything that I've talked about today. Please do so. We'll also be updating our data. Obviously, we're going to carry on tracking this as the weeks go on. So if you want to see our latest data, you can go and find that on our website as well. So that leaves me just to say thank you. If you are interested in hearing any more about this, or if you've got any questions, I'd be really interested to hear from you. So please do get in touch. Thank you. Thank you for your time today.